video, I wanted to talk a little bit about ovarian cysts, and the reason is I recently have a family member ask me about an ovarian cyst that was noted on ultrasound. And this is a great subject, just like thyroid cysts, and I think I'll make another video about thyroid cysts because it's so common to get questions about this. But in this case, we're talking about the ovaries. The ovaries, we know we have different stages of follicular development. We have some cysts that could be normal, some cysts that are abnormal. And the reality is when you look at cysts on imaging, a lot of times you don't know exactly what kind of cyst it is. However, you have some indirect clues that guide you one way or the other. And things you consider are, number one, the patient's age, number two, patient's symptoms, and number three, I will say size. In addition to that, a more technical component is really assessing the sonographic appearance, namely the appearance on ultrasound or other imaging modalities of this cyst. And this is beyond the scope of this video, but just know that your radiologist is looking at different details about what's happening with the cyst and septations and a lot more sophisticated details. But in general, a cyst that's small in a woman of reproductive age, let's say, and by small we mean less than 3 centimeters, there's a very important article out there that for asymptomatic cysts less than 3 centimeters, it doesn't recommend follow-up. So that's what I should say. And I'm going to link to this article in the video description, just because I know many of you out there might wonder what guidelines are usually followed, what should you do when you have a cyst, when you should get another test or any other follow-up. And the reality is this is based on asymptomatic cysts, and there can be some variation depending on your own specific situation. But just to give you an idea of what people do, so that's an example.